Hi, everyone, and welcome to tonight's webinar. My name is Emily Kelly, and I'm one of the peer support pharmacists with the IIOP. So tonight's webinar is Digital Health and Pharmacy, HIQA's role in supporting the Irish digital health and health information landscape. So it's another in kind of a different aspect on digital health compared to some of the webinars we had over the past year. Just a reminder that the webinar is recorded. Please keep your microphones muted. You can have your videos on and off as you wish, but if you're having problems with connectivity or anything like that, please turn off your video. If you're having any difficulty with sound, make sure that your speaker is not muted or turned down on your computer or phone. And sometimes also if you just try logging in and out again, that can really help. You can use the chat box for questions and comments, and I'll be monitoring that throughout the presentation. We've got two speakers tonight who are going to speak for about 45, 50 minutes. And at the end, we've about 10 minutes of questions. So if you put your questions in there, we'll put them to them at the end. And we may use some anonymized information from the webinar. And Grace is going to pop also a post-webinar survey in the chat box. She's going to do it straight away, but we'd really appreciate it if you could fill that out at the end as well. So without further ado, just to introduce you to our speakers, we've got Dr. Kevin O'Carroll, who's Programme Manager with Health Information Standards in HIQA, and Deirdre Hyland, who's also Programme Manager with Health Information Standards HIQA. So I'm going to hand you straight over to Kevin now. Thanks a million, Kevin. You're going to share your slides there.
Yeah,
Yeah. Brilliant. Yeah, they look great.
lovely. Thanks a million, everybody. Kevin O'Carroll, Programme Manager from Health Information Standards team in HIQA. Myself and my colleague Deirdre Hyland are going to talk you through sort of the work that we do through sort of setting the context and talking through a couple of the program projects that we have ongoing and one that we have established. So we'll take about 45 minutes on this. I'll start initially. Deirdre will take over for me, and then I'll come back in at the end. So, HIQA, just one second. We're a statutory authority established in 2007. We're an independent and we're established to promote safety and quality in the provision of health and social care. But people are very familiar with us from the point of view of the regulatory perspective. We do have other outward facing teams. We have the health technology assessment team, which kind of undertake health technologies assessments with the audience being sort of, and the intent of those being given advice to administer on new programs that should be established, maybe in lines of vaccination or screening programs, things like that. We also have the health information function. Myself and Deirdre are going to try and explain all that to you and explain our work and how we're placed in a bigger, broader context over the course of the next 40 minutes or so. So, for the purpose of the webinar, just an overview. I'll cover the introduction to the function and some of the broader initiatives that are ongoing in this space. Then we'll talk to four separate projects. Deirdre will talk to national engagement on digital health and social care, the findings which we published in 2024. And Deirdre is also leading or managing the national guidance for responsible and safe use of AI in health and social care. So Deirdre will come in and speak to those two. And then I'll come back in and talk to you about the national standards for information management in health and social care. And I'll touch on two projects we have ongoing at this moment in time, a revision of our demographic data set for health and social care and the national standard hospital discharge information. We're going to try and cover a lot. We've put together a very large slide deck. We may pass over slides quite quickly. They're there sort of for the purpose of the watch back, or if you want to look at these in your own time afterwards. So there's a couple of slides where we'll get to time. We may actually just touch on them, introduce them, and move on. So the first section, introduction to HIQA and the health information function within HIQA. What's the context for our work? This is just to sort of set the broad picture of the work that we do within health information. We're very much influenced by European policy, national policy, and national strategy. And I'm going to touch on some of these things. So people will be familiar with GDPR. Since GDPR, the EU developed the Data Governance Act, the Data Act 2021, the AI Act 2024. And in March of this year, the EHDS, European Health Data Space Regulation, was finalized and enacted in March. I have a couple of slides on that at the end. It's actually informing our program of work and a lot of developments that are going to need to be taken in the area of primary and secondary use of data in Ireland. From a point of view of policy, we've been established we get our remit from the Health Act. This was broadened in the Patient Safety Act of 2023 towards moving us into as now covering private healthcare facilities. The Health Information Bill is also progressing through the Houses of the Office at this moment in time. So that's sort of the national policy. We have had strategies over the years. We've always been focused on trying to undertake work to help progress these. So we've had the 2004 Health Information Strategy through to the 2013 Health Information Strategy, Sláinte Care, AI here for good. One of the biggest things which is influencing our direction at this moment of time would be the Digital Health Strategic Framework published by the Department in 2024. So I'm going to touch on that next. I'm going to come back to the EHDS towards the end of my section, and I just want to introduce you to that. We have actually quite a poll on that because I'm curious to know what people know about that in the first instance. So we will get to that. So one of the key national developments recently has been the Digital Health Framework for Ireland 2024 to 2030. It has 6 principles. The first principle, and supporting this, the HSE developed an implementation roadmap. So the strategy was developed by the department. HSE developed the implementation roadmap, and it's going to guide a lot of the investment and developments that take place in the health information space over the next years. So principle 1 and 2, patient as an empowered partner, and workforce planning, is sort of putting people and service users at the center, and putting people who deliver services to the service users at the center of the care. And for the workforce, giving them the tools, technology, and skills to be able to implement those. But in order for that to happen, we need digitally enabled and connected care, which is principle 3. It calls for future investments and architectural decisions to be based on the ability of systems to share clinical information and deliver connected care. So it sets a North Star of a digital health record for everyone who receives care, and this to be governed by national policy approvals, procurements, and deployments of same. Principles 4 and 5 talk about our service being data-driven, having a digital health ecosystem informed by innovation, and underpinning all of these 6, it requires secure foundations and digital enablers. Identified are the likes of cybersecurity resilience, having the roadmap in place from the HSE, strong governance, cultural change, having standards in place for health information, and that's one of our functions. Interoperability was also going to be another key. That's another area that we work on. Architecture, legislation, say architecture is probably over with the HSE, and legislation is very much with the Department of Health. So those 6 principles, HIQA, we touch on all of those. We're very much involved in the digitally enabled and connected care and secure foundation for people. We look to those. We look at them. They help to inform our business plans and the projects that we're going to actually take on an annual basis. And we agree those with the Department of Health. So we are very much plugged into the strategy in the Department of Health. So that's one big key. So I'll now dip into what we are and who we are. So our function, when I break it down, we aim to provide leadership in defining the health information landscape, and we've worked with the department and that and set some policy papers or some of our own vision for the health information in landscape to inform policy. We set standards over the years. I'll touch on those. We've developed guidance. We've made recommendations as well to where we thought that there were areas where things need to be undertaken to progress the digitalization of the health information system. We look to drive quality improvements in health information, and we've done a lot of work across the health information function over the years on data quality initiatives. And we've attempted to establish the foundations for e-health through some of our recommendations, getting those implemented, some of our technical standards. So Those are the sort of four, how we break ourselves up into our own vision for how we can help improve the health information system. We're currently, we sit within the Health Information and Standards Directorate. We have the Health Information function. There's two other functions within that directorate. There's the National Care Experience Programme, who undertake a lot of national surveys, and with the Health and Social Care Standards team, who develop standards like the standards to say for better healthcare. We're divided up into two teams. Myself and Deirdre are here from the Health Information Standards team today. So we develop standards. We will talk to a couple of those later on in the presentation. We also have a remit to support implementation through tools, guidance, and frameworks. And Deirdre is going to talk to you about guidance on the safe use of AI. We have a second slide. They're the Health Information and Quality Assurance team within the Health Information function. They very much have a quality hat on. They develop implementation and support and training. They've taken over now the evidence for HI policy and sort of developing of recommendations. They have an assurance and review function. I'll talk to our health information management standards later on. We do have a remit to be able to assess services against those. And they also work in the area of data quality and utility. Very much focused on the secondary use of data over the years, but now we're broadening that out to the use of data as well. So, what is health information? I'll touch on this briefly. I won't talk to it too much. I'm going to go back to it later on in the presentation. So, on the left-hand side, you have that data information life cycle. So we have the collection of data in primary use, organizing and checking, analyzing of it, sharing of distributing, and then the change and improve. You have green arrows and blue arrows pointing back out. The pink arrow sort of points to the start of the cycle. The green arrows and blue arrows point back out. So bear that in mind. Data has a life cycle to create information. It can be used for personal primary use of information, both individuals and health social care professionals, and secondary use at both the organization level and national data collections. So, how does the Health Information Standard team support good information collection and management? I mentioned to you we set standards to drive improvement in the standardization of information across the health and social care system. We see standardizing of the information in the first place is a key step to enable it to become digitalized and to be electronically shared. We also develop guidance, frameworks, and tools to help services and organizations implement standards and improve practices. I'll talk to the health information standards. I'll leave a slide there on the tool sets that are the guidance documents that are there. We also have frequently asked questions and a flyer for that. So we do develop, whereas we develop standards, we will develop implementation tools or tools to help people support them. We're not actually an implementation body ourselves. We've done quite a body of work over the year in our health information function, and this sort of tracks the standards that we have developed over since 2011. I'll point out two to you to sort of set the context. We, in 2015, developed a data model for a medicinal product reference catalogue, i.e. a dictionary of all prescribable items. That went back to 2015. We waited for it to be picked up by the HSE, or the implementation body. They have established a national medicinal product file project whereby they are implementing and developing a national catalogue of medicinal products. We do the standards, and we quite often then sit on their advisory board. So I would sit on that board. They're progressing it, and they're currently authoring all of the prescribable and dispensable products. Their upstream sources are PCRS and the Health Products Regulatory Authority. They're developing a toolkit with the ambition of actually publishing this on a month and revising this on a monthly basis, a national catalogue of all medicinal products, which can then be picked up by national programs, both within the HSE, say for acute or community prescribing. We would also, in 2018, develop the National Standards for Community-Based E-Prescribing. Again, there's a project ongoing in the HSE to support the rollout of that. You would all have been aware that Health Inc. or the electronic prescriptions, the setting of electronic prescriptions was legalized in 2020 through Health Mail for GPs. That's very much an email-based system, but there's a project ongoing to sort of build on that and turn it into structured data that can be actually more readily reused for primary and secondary use. So from a standards area, we've been working in this space for quite a while. From a recommendation, we have developed quite a few recommendations in this space. We've been trying to push the unique identifier and patient identification standards since I first joined HIQA. Our first publication was recommendations on individual identifiers. We've gone through the area of recommendations so that SNOMED CT can be adopted and used in our clinical information systems. And again, we would chair the governance group that is working with and giving oversight to the HSE on the role of the SNOMED CT here. We've done other areas in the space on rolling out patient summaries, recommendations on e-prescribing. So there are a lot of areas that we've done where we've actually done recommendations rather than standards to try and progress and help the system. So the last area I have in this section is I'm going to talk to you about another big initiative which is coming down the road, the EU regulation on the European health data space in primary care, and it's very much influencing our work. But we have a poll here. I'm very curious to know, just at a quick baseline, what people's knowledge of this is at this moment in time. So perhaps we could run the poll.
Excellent. I think everyone's answered that now.
I'm very curious to see, because I'm going to share some information on this. 46% low, very, very low average. 13% high, which is good. 21% average. Okay, no, it's not. It's nice, and that's actually very useful information to us. So we've gotten something back from you after this. I want to talk to you briefly the last couple of minutes on the European health data space. Coming from Europe, Europe is actually implementing 14 health data spaces across the area of agriculture, manufacturing, and health, and they decided to go with health first. Bless them and bless us. So its aim is to improve individuals' access and control over their personal electronic health data from anywhere within the EU for the provision of primary care and to facilitate secondary use of large anonymized data sets for the purpose of research, innovation, policy making, and regulatory activities. The benefits as seen for the EHDS are there in the two blue boxes: better diagnosis, better health policy. And it identifies 4 actors and benefits for those. So individuals, health professionals, policymakers, and researchers and innovators are there. So those are the sort of benefits that are there. I'll leave that slide for you to look at offline. But what I like is this slide. This is what this is going to mean for me and you as an individual. So you can see yourself there as a natural person. We're going to have access to our health data. We're going to have a downloadable copy of our health data. We should be able to view who has accessed our data all the way through, say, appointing an authorized person, requesting rectification of our data, putting yourself in the middle of it all. You can then have all of this control over your data, potentially shared with your healthcare, other healthcare professionals who have to go through a feedback loop of resubmitting your data so that you can actually, again, access it, view it, set access restrictions. How is all this and when is all this due? Well, it's going to come on a phased basis. 2 phases are envisaged and signed in so by March 26th of March 2026 or 2029. That cycle for information should be available to all of us from the point of view of patient summaries, electronic prescriptions, and electronic dispensations. By March 26, 2031, laboratory results, medical imaging reports, and hospital discharge reports will be mandated to be integrated into your national health information system. say, I'll give you a use case. Me as an individual should be able to have a prescription dispensed anywhere within the EU. So, in order for this to be done, a lot of infrastructure would need to be put in place. The part of the EHDS requires member states to set up three bodies: a digital health authority, which will have to support and set up all the infrastructure for this; a market surveillance authority, which will be tasked with certifying EHR systems that are placed onto the market; and a health data access body, which will be in the area of secondary use. I'll touch on that. The department at this moment in time are identifying the organizations who will be tasked with those functions. We are progressing in the secondary use through the Health Data IE project. A project to establish the health services for the health data access body in Ireland. So this is for secondary use. It's a EU funded project. It's a collaborative approach between ourselves and HRB, the HSE, and other key stakeholders. There are 5 key areas of work which are progressing for secondary use. We have 3 of those work packages. We're looking over a program engagement. We're developing a national registry for national data catalogs, so that data holders will be able to publish the data that they hold. And we're undertaking a lot of work on data quality enhancement. So I'll leave that there. There is actually a website there on that information where more information can be provided. So that sort of sets the context, and I tried to plug where HIQA are doing it, where HIQA are established into that. I'm transitioning now into handing over to Deirdre. We will talk over the remainder on, say, the engagement, the information management. There are 2 recent projects and 2 current projects. So with that, I will pass over to yourself, Deirdre.
Thanks. Thanks very much, Kevin, and good evening, everybody. Delighted to be on this webinar, kind of talking to you about the work that HIQA does in the health information landscape. So Kevin's going to navigate my slides for me, so I'll just give you a prompt, Kevin, kind of when to move on to the next one. So just if you wouldn't mind moving on there, and you can go again. So the first project I'm going to kind of give you a quick overview of is the National Engagement on Digital Health and Social Care. So this was a kind of a partnership project that was kind of undertaken by HIQA, the HSE, and the Department of Health. It built on work that had been done already, a national public engagement survey to gather attitudes and opinions of the public in relation to the collection, use, and sharing of health information, and the findings kind of report and also like the data files, etc., were all published back last September 2024. So next slide there, Kevin, please. So the aim of the National Engagement Project itself was to understand the opinions and attitudes of not only the Irish public, but also professionals kind of working in health and social care in Ireland in relation to the digitalisation of health and social care. And why did we do this? Well, the WHO kind of promotes it's really important to assess local needs before you implement new digital health and social care systems. So as part of our role in HIQA, a key function is to prepare evidence to support policy and practice, and that's why at the time the HSE were developing the patient app, and the department were also kind of developing the digital strategy. So they really wanted to know what the public and the professional attitudes were, and the readiness was around kind of a more digital health and social care system going forward. Coupled with that, we had the European Commission goals, kind of like that Kevin touched on under EHDS, around people having access to electronic health records. So again, a key aim of this project was to be able to kind of understand, kind of how ready people are and what types of supports might be needed to support people in a more digital kind of health and social care delivery kind of system. The Health Information Bill, again, kind of like sets out provisions around information to be collected in electronic health record, and the department were keen to understand any kind of resistance or reluctance for people to have their information in an electronic health record. And then, as I said, it all sat within kind of the digital health framework being progressed. So we go on to the next slide there, Kevin, please. So what was the approach? So we used a phased approach. We used a mixed method. We conducted kind of like both surveys. with the public and with also with kind of health and social care professionals who needed to be registered with kind of a professional body. And we did a number of focus groups, kind of again with kind of harder to reach minority groups and across the range of kind of the multidisciplinary health and social care professional kind of it's kind of groupings. And then we produced the report on the findings. So on to the next slide there. So who participated in the survey? So we had over 2,000 members of the public, kind of a good mix of male, female, range of age participants and a good regional spread. We worked with an external kind of survey kind of provider to ensure we had a representative sample kind of across members of the public. And we were really keen, I suppose, to understand if there was any difference in terms of the opinions and attitudes and readiness for those older cohorts versus the younger cohorts. So it was really good to get that kind of broad representative kind of sample from the public. And we also had 1,020 professionals that we surveyed, and we had 6% of the kind of that sample were from pharmacists, both community and hospital-based pharmacists kind of participated in the survey and also engaged in our focus groups as well. A lot more females kind of from the professional side of things, but that is representative, I suppose, of kind of the the nursing kind of profession. And we had like 52% of the people who participated in the survey were from the nursing background. So when we had a look at the kind of the staff surveys from the HSC, it was a fairly good kind of representative sample kind of from the professionals as well. On to the next slide there, Kevin. So some of the key findings, and look, we've a report, nice infographics and other assets available on our website, and we've also shared them kind of for them to be circulated with yourselves afterwards. But what did the public tell us? Well, they really said they were ready kind of to engage digitally. Kind of as people know, we're probably a little bit behind in Ireland in terms of European counterparts around kind of the digital health environment. 74% of people said they would access their online health record. People were comfortable getting texts and email reminders, and I know it's something that's already kind of embedded within kind of community pharmacy, a lot of these text and email reminders kind of, so it just shows, people are already kind of in this space. And 55% said they would access digital services if available. On to the next slide there, Kevin. Another key finding from the public was that they want to manage their online health record for practical tasks. So people want to be more empowered. They want to, go in and update their record or contact professionals about mistakes or missing information. 90%, interestingly, said they wanted it to renew prescriptions for regular medications. So they really saw that as a key advantage of having kind of access to their record. And 89% wanted to track progress of test results. On to the next one. Again, this is similar. I won't kind of go into the detail on this because I want to call out some of the pharmacy specific kind of findings. But it really, again, like people saw it as a tool to empower kind of their autonomy around their own active participation in decisions around their care. So we go on to the next one, Kevin. We'll get into some of the key findings from the broader kind of professional perspective. So professionals told us that they think an online record will empower people. So similar to what people were telling us, the professionals agreed. And we have some nice quotes there. I suppose a really important piece is that professionals, 88% of professionals thought that the public be better prepared to ask questions by having access to their own records, which is, a really positive space to be in. On to the next slide, Kevin. But when we asked professionals what they might need to kind of make them feel comfortable interacting digitally with the public, like training and technical support were the standout things that people told us. 92% said they wanted clarity on who to contact for technical support. 83% wanted training on the digital tools, and 79% wanted protocols in place. So even though they felt that they were ready and the public were ready, like those important kind of, supports were called out very specifically by professionals in the survey. And they also said that they need policy direction and guidance. And this was in particular in relation to clinical note taking, which is maybe less structured information than information like capturing kind of medication. So that was one area that we kind of like were able to call out for kind of, from a policy and an operational perspective as well. And the next one. So what did the people who participate from the pharmacy perspective kind of tell us? Well, kind of professionals want decisions around digital delivery to be person-centered and informed. So we see kind of quotes from some of the pharmacists here who participated in the focus groups. They feel that pharmacists also told us that they thought professionals feel that digital access to health records will improve transparency and trust, and they think that online records will empower people to be more in control of their health. So just on to the next slide there, Kevin. So when we had a look at some of the kind of the key questions and how the broader kind of people who the overall kind of number of professionals who answered these questions versus the pharmacist kind of perspectives, we pulled out some nice comparisons there. So similar kind of a higher proportion of kind of the pharmacists, I suppose, indicated the importance of the training and the digital tools. The measures to keep services and information private was slightly higher, again, kind of from the pharmacist cohort. The measures to keep services and information secure from cyber attack, again, slightly higher than the kind of the general survey response rate. And then the protocols. So I think, pharmacists obviously like the structures, the processes, and the measures there to make sure that the information is kept kind of appropriately and safely. So just nice to see some comparisons there. And just, I think there's just one more slide. And then when we looked at kind of what pharmacists told us around the challenges to delivering care digitally, I think a key standout was 50% of them said that the lack of standardized ways of capturing and sharing information was, a real challenge to delivering care digitally. And I think it's so important in terms of obviously medication safety. So that was probably, kind of to the forefront of the minds of the pharmacists who filled in the survey. A lesser proportion of the pharmacists indicated that IT challenges of people who use services would be a challenge to delivering care digitally. So yeah. And as I said, all the kind of the data files with all the detailed information is available for anybody who'd like to do kind of any further analysis or kind of secondary kind of research on the data there. So why did we do it, and how do those findings get translated into kind of actions? I suppose that was the whole kind of, benefit of having it as a partnership program, that each of the partners agreed to kind of take the findings and use them, whether it was to inform kind of legislation for the HSE in particular. It was a key kind of input into the development of the patient app. And then from HIQA's point of view, we're kind of using it to inform our kind of program of work as well. In particular, kind of it aligns nicely with the next project that I'm going to give you a very short overview on, which is the development of national guidance for the responsible and safe use of artificial intelligence in health and social care. So this is a project that's very much live at the moment. We're, working our way through it, and we'll be going out for public consultation kind of on the draft guidance in November. So we'd really love for, kind of people on the webinar here to respond to the public consultation when it comes out. Just on to the next slide there, Kevin. So again, I was new to artificial intelligence when I started this project kind of at the start of the year. So what is artificial intelligence? It's very much an evolving and dynamic kind of space at the moment. And depending on where you look and what you look up, you'll see different kind of definitions. But I suppose at a high level, it's defined as the ability of machines or systems to perform activities that mimic human intelligence. And I think that's the big piece there. It's not, it's the mimicking the human intelligence, such as recognizing patterns or making decisions based on data. And it's already, integral to lots of different parts of our life, and increasingly will be part of, central to kind of like health and social care systems kind of going forward. So I've just included some examples there. I won't go through them. And again, it's really just, I suppose, it's a complex subject matter. So we were trying to just make it relatable kind of in terms of everyday kind of uses that people are already comfortable with. So we might just move on to the next slide. So why are we kind of developing this national guidance? Well, a key piece of legislation came out last year, the EU AI Act. And this is really a landmark piece of legislation internationally. Like the EU are really kind of, I suppose, providing leadership in this space. There isn't similar regulation or legislation elsewhere, and it enshrines that AI is developed and deployed in a way that's trustworthy and addresses the risk of AI to citizens' health, safety, well-being, and fundamental rights. And it provides, I suppose it's not a health and social care specific kind of piece of legislation. So it provides kind of requirements and obligations for both the people who develop the systems, but also the people who are kind of using them. And it has a risk kind of based categorization of those risks. And a lot of activities that are undertaken in health and social care fall into this high risk kind of category. And therefore, there's a lot more requirements in terms of kind of, using AI in those scenarios. So we might just go on to the next slide. So this is a big area. There's a lot of work happening in the space. It's not just the work that's been progressed by HIQA. We're linking in very closely with the Department of Health and the HSE because there's interconnected kind of programs of work to promote and drive the responsible and safe use of AI in health and social care in Ireland. So the Department of Health and the HSE are kind of developing a national AI strategy, and that was committed to in the programme for government. So that's due to be published kind of, very soon. I think it's at the final stages in the department at the moment. And really that sets out, I suppose, the vision for Ireland kind of going forward in terms of AI as part of health and social care services. And the department then commissioned HIQA to develop this national guidance to promote and drive kind of the responsible and safe use and really take some of the guidance that's out there that's more broad and make it more health and social care specific. So the guidance itself will sit in within that wider context. Just on to the next one, Kevin. So really we're developing this kind of using our well-established kind of 4 principles of a human rights-based approach, responsiveness, safety and well-being and accountability. And the guidance is intended for use in all services and organisations that provide health and social care to develop and embed good practice. But it's also there to kind of empower people who are using the services by educating and empowering them. So it'll set out, examples of good practice for people managing services, people working in services, and also what people who are, kind of accessing health and social care services should expect kind of if AI has been used in a safe and responsible way. On to the next slide there, Kevin. So we've done a lot of work to date. We've done a public scope and consultation. We've convened a working group. We've conducted an evidence review. We've conducted some focus groups and interviews, and had some good input from kind of the pharmacy perspective across kind of the scoping consultation and the focus groups. And there's a couple of slides in the slide deck that calls out some of the information that was provided from that perspective. I won't go through it. And really, we're working now towards a draft document for public consultation that should be launched in early November. So again, we'd really love your kind of input and to hear from you kind of on that draft document and understand if it will help kind of a pharmacist kind of to use AI in a safe and responsible way, kind of when they're using it as a tool to support the delivery of their kind of service. Yep, so I'll let you go through the next few slides there, Kevin, kind of just again, it's just calling out some of the key things that came out in the scoping consultation, kind of from the broad sense and then also from the pharmacy perspective and who we got input from to date, just to make it kind of more relevant for the audience. And again, the continuous evaluation and the education training and workforce and upskilling, similar to the national engagement project, were key things that came out from that community. Yep, next slide there, Kevin. Just here's some of the key themes that have come out from the evidence review. I won't go through those in detail in the interest of time. And then again, our focus groups and stakeholder interviews, just letting you know who we've engaged with to date and kind of the number of people and the range of kind of perspectives we've gotten input from to inform the draft for public consultation. And just on to the next one. And I suppose this is just the next step. So we're really kind of working with this co-production working group with a lot of kind of external subject matter experts. And kind of the public consultation, I suppose, is the real kind of opportunity for yourselves to input in and help kind of shape, I suppose, the guidance kind of before it gets finalised and submitted to the department kind of early next year. So thank you for listening, and I will hand you back over to Kevin now to take you through the last kind of few slides on the national standards.
Okay, I have 2 topics I want to cover. We've 20 minutes left. I'll cover over these quickly. We'll be circulating the information in the slide decks, and they're quite, some of them are quite text narratives, so you'll probably understand. You'll be able to see where we're going. So the one I want to introduce you to is the national standard for information management in health and social care. These are national standards. I had presented this earlier on, both the data information life cycle and how data originates in primary care, can go back to secondary care and can be used in secondary use. So I'll fly through this. We had information and management standards for national health and social care data collections or national data collections. We initially were focused on sort of standards for the areas, the big data collections, the HIQAs, the PCRSs, things like that. And we've undertaken 5 reviews. In findings from our own review programs, plus these have been 2017 standards. There have been lots of other initiatives that have occurred since that, including GDPR have been published. We undertook a revision. An advisory group was established as part of that process. And it was suggested to us that we needed to revise the standards, but they need to be much broader. They need to actually cover all services that collect and use and share information, because data is actually a key resource within those services. So we do have a remit to actually go out and assess within organizations that were in HIQA's remit. We do have a remit to go out and actually review the implementation of these standards. But they're a great resource as well for organizations that aren't actually in our remit. So the use and the management of your information, that's the approach we took. Look, it's a similar approach, so I don't really need to talk to that. And we are using the same principles that Deirdre mentioned as well. So these are all integrated into our standards development processes. But we have like various there, say, underneath the principles, the human being safeguarding, our human rights-based approach, we have a standard on protecting privacy and confidentiality. And it's very clear if you go look at the standard, what this is. It will give a description on what this is from the point of view of the service user. It will give you a description on what this is from the point of view of the organization and things that you need to do and put in place. And then it lists off features. So within, say, potential protecting privacy and confidentiality, it will talk to say there should be an individual specifically with a role in guiding the organization in the area of privacy and confidentiality. You should publish a privacy statement, undertake DPIAs where required. And services should undertake audits on their data quality and set up data quality initiatives. So they are in that standards. They're broad. They're everybody within health and social care who manage data leading to information. They're a very good resource themselves in their own right. So I'll take the opportunity to point you towards those. We will be circulating the link on our website to those tomorrow. There's about 6 supporting documentations. The assessment and judgment framework you don't have to worry about for now, because that's more for the services that we can review. But there's a very good FAQ on it. There's a very good flyer on that as an introduction into them. And that can be then good to actually look towards the different principles, the standards underneath them. Lastly, we had planned, and we're 16 minutes left. So I'll introduce you to 2 projects that are live at this moment in time. And we're revising 2 of our standards. Our national standard for demographic dataset, which was last published in 2015, and our national standard for the hospital discharge information. This is again, we would say our standards, they're health record, health information standards. We need to sort of publish what information should be collected as a way of actually then helping for it to be collected within health record systems, for it to be digitalized for the transmission of care. So this is why we develop our standards. We see them as an enabler of the digitalization of care. And the demographic standard, its aim is to promote safety and quality, safe quality care and support by ensuring individuals are identified correctly and assisting service providers to collect core demographic data about individuals using their services to facilitate administrative functions, service planning, secondary use, dental purposes. On the right-hand side, we have identified sort of the 6 areas that are in the standard. Our standards, we sort of set now on for each part of the standard, the structure. So we've gotten into for each field, a description of it, whether it's mandatory, required, or optional, and the number of instances of this. Say whether it can be a single instance, multiple instances. We're starting to identify value sets, terminologies, and classifications that are appropriate for all of our standards. So we're sort of beginning to use this structure to move into that space, and we give guidance for each of the elements within the standard. So the structure, we sort of set on that structure of standard. We'll be using this for all of our standards going forward. We're undertaking a public consultation on the demographics. PSI submitted a response. They were positive regarding the guidance, conformance, and cardinality. Some potential challenges regarding information were related to the multiple legislative requirements on pharmacies, and they would have identified, in order for pharmacies to support the implementation of the standards, would be education and training and practical results, as, for example, case studies. So they have been, we finished the public consultation on those. They're in their final revision to go back to the working group next month, and we were hoping to have those published following that. The second program we're currently working on is, we had a 2013 in standard on hospital discharge summaries. So we've started with that, and there's a lot of initiatives in this place. Again, that's a 12-year-old standard. The EHDS, the European Union, have developed a lot of, sort of identified a lot of requirements for that. We're in the process of revising that standard. We're about to go out to public consultation on this later this month. If you do have any feedback, or people, we would be delighted to get responses back in from this community. I know, my understanding is we both hospital side of things and community side of things, and so any information that can be, again, we're doing a 6-week publication or consultation. We will review the feedback that we get on those and a revision of the standard to bring it back up to our own government structures, and then we submit them into the Minister for Health for approval. So, with 13 minutes left, thank you for your time. It's been a whistle-stop tour. We've flooded you with a lot of information. We did it for purpose well, a lot of the slide decks. It's a good mechanism for people to actually come back to the information, or people who haven't seen the information. Be able to see all the information that we wanted to share with you. So I'll stop sharing, take a breath, and prepare for any questions.
And Deirdre, thanks a million for that. Yeah, definitely a whistle-stop tour. And I think as a community pharmacist, for me, where we're still using a lot of pen and paper, it's great to see that North Star and that vision in the digital health framework, but also the European health data space, and that slide where you actually showed it to visualize it and say that, like, we want to get there, and also then I suppose to show that your research from patients, as patients are ready to get there too. I thought it was interesting that pharmacists particularly said the lack of standardization and the ways of capturing and sharing data. And I was just interested in, I understand that your remit is around setting the standards and you're not the implementators. And then if you don't fall under that, how do you ensure those standards are being met across all the health services? Or I don't know, is that a possibility?
I can talk to that if you want.
Thanks, Kevin.
We're a standard setting body, so we undertake the work, do the evidence, and build a draft standard, go out to consultation on it, focus groups, all of that with experts to inform the standards. Ministerial approval. We have a review function, which by we're down the road, we can assess services whether they're actually implementing the standards. But what we do require, say, national projects to be set up. At this moment in time, like the referrals would be a great one back to 2011. There was a national project to implement them set up. The e-prescribing, there's been a bit of a lag delay between us publishing the standards and the national program, which has been stood up on the HSC side to implement them. We usually sit on their governance groups. And sort of giving advice in more in an observer capacity, because if we were to ever review the program, we couldn't be seen to be
Implementer, yeah.
But say if there's something that we want to suggest to them that maybe is going against our standards, we're in a capacity to do that. So we do need national programs or projects set up to implement the standards. We stay plugged into those projects through their governance groups. And then there is always the potential to review against the standard at a later date.
And I
So we're
suppose, as you say, Kevin, for those of us that don't fall under you, to be aware of the standards and following them and setting them, as in they're helpful to all organisations.
they're a great resource. The
Yeah.
information management standards will give you excellent resource if you want to look at the organization. There's we've done a lot of work on data quality on our
Yeah.
website and data quality frameworks and things. So there are resources there that are useful. Even if you don't have to enter outside of our remit.
There's questions coming in here. Where are we currently standing in electronically sharing information, for example, transfer of care of a patient between hospitals? That probably doesn't fall, that's outside your remit, is it?
It does. We're
Electronic
doing
share
the
code record. Yeah.
yeah, we're okay. We're doing the hospital discharge information standard. And again, we will bring that to as far as we can with defining it. Services will have to implement that standard through the discharge summary process and then preferably through electronic means. If we're getting into the likes of the shared care record, the patient app, they're very much projects which are being run through the HSE. My understanding is the shared care record has been rolled out Waterford, Wexford at this moment in time. They're going to, where they have electronic data, they're going to make that available to healthcare professionals. They're not going to newly digitalize data, but if, say, a discharge summary was being messaged in electronic format and they can bring that into the shared care record, that's what they're going to pull through into the shared care record.
And there was a previous webinar in, I think, May last year where the HSE team did present around some of that if people wanted to look at that resource. Similarly, in the context of e-prescribing, will the future system allow to see both prescription and OTC medication that might be obtained from various pharmacies for drug interactions? Again, I suppose that comes down to how it's implemented rather than the standards. Um,
Yeah, and I
uh,
think what's key here is, say, with the whole of the EHDS, there are three new entities or functions need to be established, and it's the Digital Health Authority will look after primary care, and those six categories of data and how they're rolled out across the country will be under their remit. So
yeah,
the first three are patient summaries, electronic prescribing and dispensing by the 26th of March 2029.
great to hear. Um, Paul has a question around, is there a standard for referral into a hospital, for example, from a GP surgery or for a nursing home patient being admitted to hospital?
There's a referral. There's a referral going back to 2011, which my understanding is implemented in all of the GP practice management systems, but it's the scope of it is into outpatient departments. So it's for referrals into out services offered
Okay.
through outpatient departments. It's not for referral into A&E, or it's not for referral into the likes of laboratory or radiology services and
It's
request.
interesting when we're talking about that, I suppose thinking, and I suppose if e-prescribing is coming in 2031, but to think that we don't have a standard around health mails and that they vary so dramatically from prescriber to prescriber. But he's also asked, what enforcement will there be for entities that do not conform with the EHDS standards and requirements? Don't know
Could
if
I
either you want to
could
take.
I ask that person to could I refer that person to whoever becomes the appointed digital health authority? It's interesting what's coming along. Electronic healthcare record manufacturers will all have to go through a self-certification process, and there will be standards and technical specifications developed by Europe. So they will have to actually have gone through a process of self-certifying. Our Digital Health Authority actually has to establish that here, guided by Europe. So it starts actually at the vendor, the manufacturer, a process that they have to go through before that their products are placed on the market or for existing products are on the market. There's a lot of work to be done in this space. It will all fall under the Digital Health Authority.
There's a lot, isn't there? And then looking at timelines and everything. Interesting. Oisin has, will private entities be considered for access to these new services like e-prescriptions? So at the moment, the ICGP accreditation limits access to the HealthLinks APIs. They need to be opened up to allow private entities and pharmacies to properly communicate, for example, to enable minor illness referrals like a 24-hour blood pressure monitoring reporting data to be shared.
Again, you'd need some advice on the HDS, but I don't think the HDS is the difference between private and public. It puts the patient at the center of the process.
And I suppose
And it's
possibly provisions within the health information bill as well, Kevin, just around the kind of the access to data from private into the public might have some provisions there as well. Like that's still a bill at the moment, but when that becomes an act, that's given additional powers kind of around the transfer of data. So there might be something there under the legislation to allow for that. Yeah. There's a
okay.
lot
And
happening, I think, from a policy legislation kind of perspective from the EU and the national kind of perspective. So there's a lot of things that will probably drive change, but the wheels of legislation are very slow in terms of from when you have the legislation to when it's fully implemented. So I think it'll be over time, but there's certainly steps in the right direction to put the legal framework there for more sharing of data between the private and the public sector. Yeah.
And there's another question there that's similar, like, so will the private hospitals be key stakeholders for the integrated health record? So that's the same answer, I suppose.
Yeah, I think
Um,
the health information bill has a lot of provisions kind of on that. Yeah. But there's a
and then
lot of
there's
negotiations still, I think, in terms of functions and allocation of functions within the legislation itself. So yeah.
um, a very specific question that I'm not sure but will the National Drug and Medicines Catalogue follow a similar model to the DM plus D system in the UK?
It's similar in that it has it's based around six concepts, action versus virtual, therapeutic. I think if I could break it up, substances, packages. It is following a very similar structure behind it, and they're doing an awful lot of work in mapping each of the concepts into SNOMED CT. We didn't adopt the DM&D from the UK because we would have had to adopt the whole of the UK SNOMED CT. You'd had to have adopted two things. So as part of that group, they made the decision to build it for ourselves to fulfill our own requirements. It's very much informed. The structure underpinning it is very very similar to the M&D.
Thank you. And I suppose one last question before we finish. Will HIQA be issuing similar guidance requiring like a CE mark for AI software as per the super clear priority notification? Yeah.
Not on our work plan at the moment,
No, okay.
and I wouldn't think it would be within our scope and our remit. I suppose we're a kind of a service kind of regulator, so really it's about kind of like the more about guidance around kind of the use of AI to support the direct kind of provision of care. I know there's in addition to the AI strategy, the department will also be developing national legislation to transpose kind of the EU AI Act. So there might be some kind of I suppose legal kind of guardrails there around it, but it's not like it's a really complex area because we've medical device regulation, product liability regulation kind of, and some of that is set out in terms of the wider context within the guidance kind of, but it's very complex and there's a lot of interplay between different pieces of legislation kind of in the AI space. So it'll just continue to evolve, I think, but it's certainly not something on our work program for the next while. Yeah.
Thanks very much, Deirdre. Thanks a million, Kevin and Deirdre. I can't believe the time has absolutely flown. I just to say to everyone, both Kevin and Deirdre really kindly offered that if there were more questions or questions that they wanted, that you could send them into HIST@hiqua.ie and that will go into the team there to answer them. And also all those supplementary resources, and there's a vast amount of them there, will be available tomorrow on the IIOP website. Deirdre, I was going to ask the public consultation in November for
Mm.
AI. Where would we find that, or will that be shared through the
Ye-
IIOP as well? Or
Yeah, we could certainly add you to the mailing list to notify you. What we normally do as well is we promote via our HIQA LinkedIn and other social media kind of avenues. But certainly we do have like a collated list of stakeholders that we reach out to and ask them to disseminate. So we'd be happy to include you on that mailing list. And then if you could send it onto your members, but we do promote via, press release and various other kind of avenues, but we're always really happy to get support to send it out to specific kind of people who'd be interested in it. Yeah.
That's great. Thank you both so much. Um, just a reminder to everyone as well to fill out the survey that's in the chat box. Grace has just popped it in again. We really love to hear what you want to hear on these webinars and how they went. And to remind you to, it's a good time to maybe while you have the website open to open your CPD cycle and do an e-portfolio cycle. I've been called this year, so I might do that. And our next webinar is on the 24th of September at 8 p.m. with Ellen McGrath, Medicine Shortages and Borderline Classification Manager with the HPRA. So thanks very much, everyone, and have a great night. Thank you.
Yeah. Thank you.
Thanks, Kevin and Deirdre. It was lovely to meet you.